9 o'clock, we'll go ahead and get started. My name is David Gerboth, G-E-R-B-O-T-H, and I have the honor of serving as the fire chief for the city of Salem. The Salem Fire Department has proudly served this community and Oregon's capital for more than 168 years. And throughout this time, this department has continually adapted to meet the evolving needs of our community, and today we embody that evolution. Today we're putting into service our pilot program for the Rapid Engagement, Assessment, and Community Health Team, REACH. The REACH team is designed to address the growing number of 911 calls driven by behavioral health challenges, substance use, and other complex social needs, calls that traditional emergency response alone cannot always resolve. REACH provides a more appropriate and effective response by pairing the Salem Fire Department paramedics and emergency medical technician with a Marion County Health and Human Service behavioral health associate. Together, they engage individuals early, connect them with the right services, and help break the cycle of repeated emergency calls. This approach is intended to improve health outcomes for individuals, reduce strain on the 911 system, decrease emergency room visits, and ensure fire and EMS crews remain available for the most serious emergencies. This program represents a strong partnership between the City of Salem and Marion County. I want to thank our elected officials, city and county leadership, and the dedicated members of both organizations who have stepped up to make this important work possible. It is my pleasure to introduce the Mayor of Salem, Mayor Julie Hoy.
Thank you, Chief, and good morning, everyone. Conversation around this topic has been going on for a long time. When I became mayor, one of my largest priorities was to enhance the partnership with Marion County, and specifically Marion County Behavioral Health. Salem can't go it alone. We need partnership to help solve our problems. It's been an honor to work with the county, the fire chief, the City of Salem manager and council, Debbie Wells, Ryan Matthews, and team to find a solution to get this program stood up, rather. I'm proud of this team, and there's no limit to what we can accomplish when we bring passionate people to the table to solve our shared problems. It's my pleasure now to introduce the County Commissioner, Daniel Bethel.
Who's super excited to be here today besides me? This is a really big deal here in the city of Salem and across Marion County. Our system is taxed. There's not a single person in this parking lot, in our county, and in this state that doesn't recognize that behavioral health systems are in crisis and our neighbors are in crisis. And it takes a unique set of skills to be able to navigate each person one at a time. I've been a commissioner now for 5 years, and I can tell you that it's been a dream of mine to be able to bring a team like this online. It takes leadership like Ryan Matthews, our administrator, and Debbie Wells, who runs our crisis center, to be able to say yes to something like this. The hill that we're all climbing is steep, but together I believe that we can accomplish really good things in this community, and I'm excited to see the work that you're all going to do. I want to say thank you to each and every one of you for the service that you provide. I know that every single day you're taxed and that we ask you to do ridiculous things, but you show up, you believe in what you do, and you care about your neighbors. And to me, that's greater than any system that we could design one by one. Thank you for saying yes to the job, and I look forward to seeing the data decline over the next 6 months. And now, Vanessa Nordyke, City Councilor.
Thank you, Commissioner Bethel, and thank you all. I am so excited. Thank you, guys. You are going to save lives. Let me repeat that. REACH team is going to save lives. I joined council in 2019, and I can tell you the city's approach to homelessness was a whole lot different than what it is now. When I first joined council and I brought up the idea of having something like a REACH team or a CAHOOTS team, the city didn't seize that opportunity. But I can tell you folks, doing nothing is still a choice. And over time, we've seen a lot of change in how our city and how our entire region addresses homelessness. We have leaned into this work, and it took creating more shelters. We worked with Marion County, and thank you, Commissioner Bethel and the Marion County Commissioners, to create a navigation center. Marion County provided funding to help us open doors to people who are struggling with mental health, addiction, and chronic homelessness. Chronic meaning that they've been on the streets for over a year or more. But that was all chapter 1. And the REACH team is chapter 2. Because even though we increased shelter, we increased case managers, we increased affordable housing, we found new pathways for people to end homelessness, something was missing from this equation, and that was the REACH team. I can't tell you how many business owners I've talked to who have urged us to go down this path, because there are so many times when a police response is not the correct response. Our own police chief has said time and time again, we need the right tool for the right job. And so I'm so grateful to our police chief and our fire chief for their vocal and unequivocal support for this program. I want to thank our city manager, Christian Namburi. I want to thank the entire city leadership and county leadership for working together, because REACH team will save lives. Thank you.
I'd like to introduce the Director of Behavioral Crisis Services, Director Debbie Wells.
Good morning. Thank you all so much for being here today. My name is Debbie Wells. I am the Division Director of our Behavioral Health Crisis Services with Marion County. I want to begin by thanking Mayor Hoy, Commissioner Bethel, Councilor Nordyke, and of course Fire Chief Gerboth for standing together today. This sends a clear message that we are here as a united group. We want to address the complex challenges in our community that require shared leadership and shared responsibility. The work we're talking about is not owned by any one department. It's something that we share, and it's something that our community shares. Across Marion County, we are seeing more people experience crisis in public spaces, in their homes, and in their neighborhoods. These are moments that often involve mental health challenges, substance use, and other unmet health needs. For community members, these situations can feel frightening and frustrating, and for their neighbors, excuse me, for individuals experiencing them, they're often moments of deep vulnerability. These situations are serious and often require a different kind of response than lights, sirens, or emergency room visits. For too long, our response options have been limited. When someone was in distress, we called 911. That's what we knew and that's what we were comfortable with. But that leads to repeated calls, crowded emergency departments, and most importantly, people not necessarily getting the treatment that they actually need. The REACH team represents a different approach. At the core, REACH is about connection. It's about meeting people earlier, responding more appropriately, and offering support that looks beyond the immediate crisis to what will help people move forward. As part of this approach, a qualified mental health associate will be joining a paramedic and an EMT with Salem Fire to respond directly in the field to help de-escalate crisis situations, build rapport, assess immediate behavioral health needs, and connect individuals to appropriate services and ongoing support. The program is designed to reduce repeated crises not by ignoring them, but by responding in a way that is more effective and more sustainable for the entire community. For neighbors and businesses, this means fewer recurring emergency situations and a more thoughtful response when concerns do arise. For individuals and families, it means being treated with dignity and respect during some of the hardest moments of their lives. For the community, it means smarter use of public resources, reduced strain, fewer repeat calls, more capacity to respond quickly to true emergency medical issues. This initiative exists because of a strong collaboration between Marion County Health and Human Services and the Salem Fire Department, supported by our local leadership. The agreement moving forward ensures accountability, safety, and a shared commitment to evaluating what works and improving what does not. Ultimately, the REACH team is about the kind of community we want to be. A community that recognizes mental health and substance use as health issues. A community that supports first responders by giving them better options. And a community that believes people deserve compassion, even in moments of crisis. This is not a single solution to every challenge that we face, but it's an important step forward. It reflects a commitment to doing better together. So thank you to our partners, to our staff, to our community members who continue to push for thoughtful, caring responses to complex needs. We're proud to move this work forward, and we look forward to sharing what we learn along the way. So thank you all so much for being here. And now I would like to invite Chief Gerboth back to the podium for closing remarks.
Well, thank you very much for being here today. I'm sensitive to the elected officials' time. If there's a couple questions, we can certainly answer those now. But after this, the members of the REACH team will be available to discuss their assignment and then look at the vehicle. Is there any questions currently? Yes, sir.
What's the one thing you want the general public to know that may not be involved? Like, they don't see the things you guys see every day. If you get one thing across to the general public, what would you want them to know?
Personally, compassion. I think this is our most vulnerable populations often are marginalized. And I know that every time that we respond, I want to make sure that when they see the Salem Fire Department or Marion County, they know that they're being treated with the utmost dignity and respect and the absolute best service possible.
Chief, can you answer me about 988?
Oh, please.
It's actually a really good question, and I think what's really important for the public to know is that 911 is for emergencies, 988 is for behavioral health. We need the public who's experiencing mental health crisis to call 988 so we can dispatch the appropriate team and provide less burden on emergency services that do other work through 911.
Yes, sir.
I can't go to any press conference without speaking of budgets, cuts, not enough funding, government, federal funding going away. What would you want to say to people that look at this and say, hey, it's just more money being spent, spend a lot of money on this? What would you want to say?
Yeah, well, we are operationally saturated as we are, and we're going to go to these calls regardless of whether we have reach or we send a heavy fire equipment. That's what we're doing now. We're sending a fire engine, oftentimes these calls, not trained, and basically respond to calls. And the only resource we have is to transport somebody to the emergency room. By broadening those services, we're sending the right resources to the right place at the right time, delivering the right amount of care. The ER is not the right place for everybody. A fire engine is the right response for everybody. So it's the right response to have the more efficient. We are going to be measuring our metrics, looking at return on investment, and making sure this is a worthy investment. We're also looking for alternative funding, including grant programs, which are certainly out there to make sure that we can preserve general fund dollars and still serve the community in the best way. Yeah. Some of the question was, what are the metrics that we're looking at to determine if this is a successful program? One is diversion out of the 911 system. We have a high number of high utilizer users. We have, for example, one person that's called 911 300 times since March. Are we going to be able to take them out of the 911 system, respond proactively to get them connected with services so that they're not relying on that alone? Diversion out of the emergency room. We have one of the busiest emergency rooms on the West Coast. Right now, the only option we have is to bring somebody in an ambulance to the emergency room. Now, working together with our community partners, we'll be able to bring to other places, such as our mental health crisis center in Marion County. There's some of our partners, agencies that have sheltering and rehabilitation facilities. Also, the return on investment for our emergency room. Just bringing people there continually is a cost to the entire community. And so looking at less repeated calls for those individuals, people that stay in treatment, and then a reduction on sending all this heavy equipment that we have, preserve those larger, more important pieces of equipment for serious serious emergencies in general. Yep, we're going to start with 4 days a week, 10 hours a day, so that we can meet, see people in the morning as well as after those traditional hours. It is a pilot, so we know that there's certainly, we could work 24 hours a day. We're doing the best under financial constraints, making sure that we do have a proof of concept as we work toward expansion in the future, if that's justified. Yeah, so we do. We have these gentlemen here. So we have a dedicated paramedic, firefighter paramedic, a dedicated emergency medical technician, and a dedicated mental health associate. We also have a relief team. So we put many people through training so that in case of injury, illness, or even a vacation day, they're allowed to take vacation once in a while, that we have somebody that can come in and we can provide that continuity of service to the community.
What does success look like for the Salem Police Department for this, maybe the fire department for this to work? What would success be?
Yeah, I think our reduction of our repeat number of 911 calls, seeing people that we have actually connected with services. Right now, we just provide treatment and then we drop somebody off in the emergency room. This is an opportunity for us to connect to services and see some real measurable health outcomes. A reduction in sending the heavy equipment, our fire engines, our ladder trucks that are already overtasked and should be responding to higher acuity calls, and then the reduction of our the amount of people that we're bringing to our emergency room, one of the busiest emergency rooms on the West Coast. So if we can get them into different services, the right resources to be treated, the emergency room is not the right place for everybody, but right now it's all we had. So now with our community partnerships, we have other resources.
Chief, may I add something?
Yes, ma'am.
I would just add that this will also help to reduce the strain on the police department and the number of calls that they're responding to in this regard. Also, a help to local business to reduce the amount of issues that they're facing and trying to keep a place welcoming for business. So, thank you.
Last question, and then we could meet the gentlemen that are going to be doing this work. All right, well, thank you for being here today. Thank you for our elected officials, city leadership, and most importantly, thank you for the members that have stepped up to do this important work. Appreciate it. Thank you for being here.
Can you get a picture with the team, the
Oh, yeah.
mayor, you, myself?
Sure, yeah.
Ryan? I know, you thought you were going to get out of it, but can we move this?